Every single night, 30 million men over the age of 50 wake up to use the bathroom. Not once, 2 times, 3 times, sometimes 6 or 7 times before dawn. They stumble through dark hallways, half asleep, wondering if this is just what aging looks like. And during the day, it's worse. The constant awareness of where the nearest bathroom is, the weak stream, the feeling that the bladder never fully empties, the burning, the urgency that hits without warning. Most of these men have been told the same thing by their doctors: benign prostatic hyperplasia, BPH, an enlarged prostate. It's common, it's age-related, and the solution? A prescription. Alpha blockers to relax the muscles, 5-alpha reductase inhibitors to shrink the gland, and when those stop working or the side effects become unbearable, surgery, TURP, transurethral resection of the prostate. They go in through the urethra with an instrument and physically remove tissue. I'm going to tell you why that approach is backwards. And I'm going to show you what Japanese men have known for generations. A method so simple and so effective that it has kept prostate disease rates in Japan among the lowest in the developed world. But first, I need to say something. The system makes money when you stay sick, not when you get better. Subscribe to Dr. Waterling right now and hit that like button. We're working toward building this channel on one principle: real solutions that your next doctor's appointment will not include. Let me be very clear about what we're discussing. The prostate is a walnut-sized gland that sits directly below the bladder and surrounds the urethra, the tube that carries urine out of the body. When the prostate enlarges, it squeezes that tube. It's like putting your thumb over the end of a garden hose. The water still flows, but the pressure changes. The stream weakens. The bladder has to work harder to empty. And over time, that bladder muscle thickens and becomes irritable, creating urgency, frequency, and that maddening sensation that you always need to go even when you just went. By age 60, approximately 50% of men have measurable prostate enlargement. By age 85, that number climbs to 90%. The conventional explanation is that it's hormonal. As men age, testosterone converts to dihydrotestosterone, or DHT, a more potent androgen that stimulates prostate tissue growth. That explanation is partially correct, but it is incomplete, and the incomplete understanding is why the conventional treatments manage symptoms without addressing the underlying cause. Here's what nobody tells you. The Japanese population has the same hormonal changes with aging. Japanese men produce DHT. Japanese men experience declining testosterone, but their rates of symptomatic BPH are dramatically lower than men in Western countries. A study published in the Journal of Urology compared prostate volumes between American and Japanese men of identical ages. The American prostates average 31% larger. Same age, same hormonal environment, profoundly different outcomes. The difference is not genetic. When Japanese men move to Western countries and adopt Western dietary patterns, their prostate disease rates rise to match the local population within 1 generation. That tells us something critical. The primary driver is not aging, it is not inevitable hormonal decline, it is modifiable environmental factors, specifically diet and specific micronutrient concentrations that directly regulate prostate cell growth. Now let me explain exactly what's happening inside your body. The prostate gland contains 2 types of tissue: glandular tissue that produces seminal fluid and stromal tissue, which is structural. In BPH, both types of tissue proliferate. The cells multiply, but this is not cancer. This is hyperplasia, an increase in cell number without malignant transformation. The distinction is important because the mechanisms that drive hyperplasia are different from those that drive cancer, and they respond to different interventions. The enzyme 5-alpha reductase converts testosterone into DHT inside prostate cells. DHT binds to androgen receptors and signals the cell nucleus to initiate growth and division. That's the mechanism pharmaceutical companies target with drugs like finasteride and dutasteride. They block 5-alpha reductase, reducing DHT production by up to 90%. And yes, the prostate shrinks. But the side effects are significant: sexual dysfunction, decreased libido, erectile difficulties, depression. For many men, the cure feels worse than the disease. Here's where it gets critical. DHT is not the only growth signal. Inflammation plays an equally important role. Chronic low-grade inflammation in prostate tissue creates an environment where cells proliferate more rapidly, and that inflammation is directly linked to dietary factors. Specifically, the ratio of omega-6 fatty acids to omega-3 fatty acids in your diet. The Western diet is heavily skewed toward omega-6 from vegetable oils, processed foods, and grain-fed meat. Omega-6 fatty acids are precursors to pro-inflammatory compounds called prostaglandins. The traditional Japanese diet is the opposite. High in omega-3 from fish, fermented soy, seaweed, and green tea. Omega-3 fatty acids produce anti-inflammatory compounds that directly inhibit prostate cell proliferation. A meta-analysis published in the American Journal of Clinical Nutrition found that men with the highest omega-3 intake had a 63% lower risk of developing symptomatic BPH compared to men with the lowest intake. That is not a subtle difference. That is a profound protective effect. But there's a second factor that Japanese medicine has emphasized for centuries: zinc. The prostate contains higher concentrations of zinc than any other soft tissue in the male body. Zinc inhibits 5-alpha reductase. It reduces DHT production naturally, without the side effects of pharmaceutical blockers. It also has direct anti-inflammatory effects and supports immune function within the prostate tissue. Here's the problem: zinc absorption decreases with age. Phytic acid in grains and legumes binds zinc and prevents absorption. Chronic stress depletes zinc stores, and the Western diet is relatively zinc poor compared to traditional diets that emphasized shellfish, organ meats, and seeds. The result is that most men over 50 are functionally zinc deficient, even if they're not clinically deficient by laboratory standards. The traditional Japanese approach addresses both factors simultaneously: high omega-3 intake from marine sources, high zinc intake from shellfish, particularly oysters and pumpkin seeds, and a third element that Western medicine has only recently begun to study: phytoestrogens from fermented soy. Now, I know what you're thinking. Soy? Estrogen? Won't that make things worse? This is where the misunderstanding is profound. Phytoestrogens are plant compounds that have weak estrogenic activity, roughly 1,000 times weaker than human estrogen, but they compete with more potent estrogens for receptor binding. In men, this actually creates a protective effect. They block stronger estrogens from binding to prostate tissue receptors, reducing the proliferative signals that contribute to BPH. A study published in the British Journal of Nutrition followed over 12,000 Japanese men for 8 years. Those who consumed fermented soy products, specifically miso and natto, at least 3 times per week, had a 48% lower incidence of BPH compared to men who rarely consumed soy. The fermentation is critical because it breaks down compounds that can interfere with nutrient absorption and creates beneficial bacteria that support overall health. Let me give you a real case. 63-year-old man named Robert. He came to my office after 5 years of progressively worsening urinary symptoms. He was getting up 4 to 5 times per night. His stream was weak. He felt constant pressure. His urologist had prescribed tamsulosin, an alpha blocker. It helped initially, but the effect diminished over time. He was being told the next step was surgical intervention. His diet was standard Western, processed foods, red meat several times per week, almost no fish, coffee and alcohol daily. I put him on a modified Japanese protocol: 3 servings of fatty fish per week, specifically salmon, mackerel, and sardines, daily consumption of fermented soy in the form of miso soup, elimination of vegetable oils and processed foods, pumpkin seeds, 30 grams daily, green tea, 3 cups daily, and supplemental zinc, 30 milligrams daily with copper to prevent imbalance. Within 3 weeks, he reported improvement. The nighttime urination decreased from 4 or 5 times to 2 times. The urgency during the day diminished. By 8 weeks, he was sleeping through the night most nights. His stream had noticeably strengthened. At 12 weeks, we did a follow-up ultrasound. His prostate volume had decreased by 22%. His urologist was stunned. Now, here is your complete protocol. This is not theoretical. This is a structured intervention based on documented nutritional biochemistry and clinical observation over 15 years of practice. Morning: Upon waking, drink 1 cup of green tea, not coffee. Green tea contains catechins, particularly epigallocatechin galat, or EGCG, which has been shown in multiple studies to inhibit prostate cell proliferation. Steep the tea for 5 minutes in water just below boiling, around 80 to 85 degrees Celsius. Do not add milk, as it binds the catechins and reduces absorption. Breakfast. Prepare miso soup. Take 2 tablespoons of miso paste, preferably organic and unpasteurized to preserve beneficial bacteria. Dissolve it in hot water, not boiling, as high heat kills the probiotics. Add seaweed, specifically wakame, which provides additional minerals, including iodine and selenium. Add tofu if desired. This gives you your first serving of fermented soy and establishes anti-inflammatory baseline for the day. Mid-morning, consume 30 grams of raw pumpkin seeds. You can eat them plain or lightly toast them without oil. Pumpkin seeds are one of the highest plant sources of zinc, containing approximately 7 milligrams per 30 gram serving. They also contain phytosterols that directly inhibit DHT binding to prostate receptors. Lunch, include a serving of fatty fish, salmon, mackerel, sardines, or herring. A serving is approximately 150 grams. Bake, grill, or steam. Do not fry. Aim for 3 servings per week minimum. If fresh fish is not accessible, high-quality canned sardines or mackerel are acceptable alternatives. These provide omega-3 fatty acids, specifically EPA and DHA, in concentrations of 1,500 to 2,000 milligrams per serving. Afternoon, 2nd cup of green tea. Same preparation as morning, evening meal. Include cruciferous vegetables, broccoli, cauliflower, Brussels sprouts, or cabbage. These contain compounds called indoles that modify estrogen metabolism, shifting it away from forms that promote prostate growth. A serving is approximately 200 grams, lightly steamed to preserve the active compounds. Before bed, 3rd cup of green tea. Some men worry about caffeine before sleep. Green tea contains L-theanine, an amino acid that promotes relaxation and counteracts caffeine's stimulant effects. Most men tolerate evening green tea without sleep disruption. Supplementation. If dietary sources are insufficient, add 30 milligrams of zinc daily, taken with food to prevent nausea. Include 2 milligrams of copper to prevent zinc-induced copper deficiency. Add 1,000 milligrams of omega-3 fish oil if you cannot consume 3 servings of fatty fish per week. Ensure the supplement provides at least 500 milligrams of combined EPA and DHA per dose. Now, what to eliminate? This is as important as what you add. Remove or dramatically reduce vegetable oils high in omega-6. This includes soybean oil, corn oil, sunflower oil, and safflower oil. Read ingredient labels. These oils are in nearly all processed foods, salad dressings, and restaurant cooking. Reduce red meat consumption to once per week maximum. Red meat, particularly from grain-fed animals, is high in omega-6 and arachidonic acid, a direct precursor to inflammatory prostaglandins. If you eat red meat, choose grass-fed when possible. Eliminate or strictly limit alcohol. Alcohol irritates the bladder and prostate tissue directly and disrupts sleep, worsening nighttime frequency. If you drink, limit to 1 serving no more than twice per week, and never within 3 hours of bedtime. Reduce caffeine from sources other than green tea. Coffee is a bladder irritant and diuretic. If you cannot eliminate it entirely, limit to 1 cup in the morning only. Timeline for results. Most men notice improvement in urinary frequency and urgency within 2 to 3 weeks. Stream strength improves between 4 and 8 weeks. Measurable reduction in prostate size, if monitored by ultrasound, typically occurs between 8 and 16 weeks. This is not an overnight transformation. This is physiological remodeling that requires consistency. Now, critical warnings. If you experience any of the following symptoms, this is not something to manage at home. Blood in the urine, complete inability to urinate, severe pain in the lower abdomen or back, fever combined with urinary symptoms. These can indicate acute urinary retention, infection, bladder stones, or malignancy. See a urologist immediately. If you are currently taking medication for BPH, do not stop it based on this video. These dietary interventions work alongside medical treatment. As your symptoms improve, work with your physician to potentially reduce medication dosages. Never discontinue prescribed medications without medical supervision. If you have a history of kidney stones, particularly calcium oxalate stones, discuss increased green tea consumption with your physician, as tea contains oxalates. The risk is generally low, but individualized guidance is appropriate for those with stone history. How old are you? Write it in the comments. I want to see which age group makes up the majority of our viewers because it will directly shape what I cover in future videos. The prostate is not your enemy. It is not a malfunctioning gland that requires surgical removal. In most cases, it is responding to an inflammatory environment created by dietary imbalances that are completely within your control. The Japanese have demonstrated for generations that prostate disease is not an inevitable consequence of aging. It is a consequence of specific nutritional deficiencies and excesses that Western dietary patterns create. Your next urology appointment will not include a discussion of omega-3 to omega-6 ratios. There is no billing code for nutritional counseling. There is no pharmaceutical profit in teaching you that fatty fish and pumpkin seeds can achieve what alpha blockers attempt to do with side effects. The healthcare system is built to manage your symptoms with prescriptions and procedures, not to address the root biochemical imbalances that created the problem. But you now have the information. You understand the mechanism. You have a specific actionable protocol. The only question is whether you will implement it consistently for the 12 to 16 weeks required to see measurable results. If this video helped you, send it to someone you care about. A father, a friend, a husband, someone who is getting up multiple times every night, convinced that this is just what getting older looks like. You may have just given them a real chance to avoid surgery and reclaim normal urinary function. Subscribe to Dr. Waterling and hit that like button. We are building this channel on one principle, giving you the solutions that work, the information that matters, and the truth that the system will not tell you. Your health is not a mystery. Your body is not broken. It is responding to the signals you give it every single day through what you eat. Change the signals. Change the outcome.